For urinary system, we start with inspection, and then later on we go to palpation, percussion, auscultation. For urinary system, first we do percussion and then palpation. Okay. Inspection of the lumbar region, because that's where the kidneys are projected. The projection of the kidneys on the lumbar region between. The projection is between T11, T12, L1, L2, L3. T11 and L3. That's the projection of the kidneys. So somewhere along this region. Somewhere along this region. So look for what? You look for any swelling. You look for any edema. You look for any changes in color of the skin over the projection of the kidneys. So absence of edema, absence of swelling, and absence of red skin over the absence of red color skin or changes in color of the skin over the kidneys projection. That's it for inspection. After that, percussion. Percussion is also known as tapping in this case. How do you do percussion? Same thing you have to percuss over the projection of the kidneys. Before that, ask the patient whether he feels pain or not. After percussion also, you have to ask the patient whether he feels pain or not. Okay, maybe a little bit below. Did you feel pain? During palpation or tapping, the patient does not feel any pain. How do you perform Pasternak symptom? The Pasternak symptom is also the same thing, but before percussing, you have to ask the patient to urinate. Like you have to ask the patient to void, and after percussing, ask the patient whether he feels pain or not. And after that, you have to ask the patient again to void, urinate. Okay. So if the sign is positive, for him it's negative. Believe me. If the sign is positive, you will find RBC in the urine, erythrocytes in the urine, and also the patient will feel pain.
Hematuria.
Hematuria. So that's Pasternak symptom. Palpation. You can perform palpation for kidneys. It's deep bimanual palpation. You can perform palpation when the patient is in standing position and supine position. Same thing. We'll do it in supine position. The same thing you have to perform if the teacher asks you. You have to perform it in standing position also. There's one more sign. One more percussing technique. What you do is you have to place your hands anteriorly, and you have to percuss like this. For example, this is the posterior surface of the body. You have to percuss like this. And over the anterior surface, if sometimes you might be able to feel that the kidney moves along your palmar surface. So this on the anterior surface, so like this. Same T11, T12, L1, L2, L3, both sides. Cannot palpate. So the kidneys are unpalpable. Deep bimanual palpation. Yeah. How do you perform? Next is deep bimanual palpation. How do you perform deep bimanual palpation? So how do you palpate the kidney by deep bimanual palpation? Like this, you have to place your hand like this. Inspire, do fold, and then take it out. You should not take it out. You have to perform it at least thrice before taking your hand out, because the kidneys are deeply located. Okay. Again, before going for palpation, we have to ask the patient whether he feels pain or not. Do you feel any pain?
No.
After that, you have to teach the patient abdominal breathing. Inspire, expire. Inspire, expire. Inspire, expire. There is no specific place for projection of the kidneys on the anterior surface. It's just over like this. Inspire, do skin fold, expire, inside, inspire, again, expire, inspire, expire. Kidneys are unpalpable. All the time, your hands must remain in the same position. Same thing for the other side also. Inspire, expire, inspire, expire, inspire, expire. Did you feel pain?
No.
The kidneys are unpalpable. The patient does not feel any pain during palpation of the kidneys. Okay, how do you make the conclusion again? During topographic,
Kidney position same. Left and right. No, left is higher.
actually I don't know. Maybe make it a little bit lower.
But
Left is higher, right?
Yeah, left is
So
higher.
maybe make it a little bit higher.
there's no specific point right for the
There's no specific, that's the problem now. We don't have any specific projections of the kidneys on the anterior surface. On the posterior surface we have. So absence of, during topographic deep sliding palpation of the kidneys, the patient does not feel any pain and the kidneys were unpalpable. In absence of nephroptosis, if you want you can tell. Nephroptosis, the stages are 1, 2 and 3. Nephroptosis, nephro is what?
kidney.
Ptosis?
Cis.
Ptosis.
Ptosis.
Ptosis, P usually is silent in English.
Oh.
Nephroptosis.
Cis.
Destruction is lysis.
The same position.
Yeah, lowering. So lowering of the kidneys.
Ah.
Lowering of the kidneys. The stages are 1, 2 and 3. 1 is, you can, if there is nephroptosis, for him there is no nephroptosis, the kidneys are unpalpable. If there is nephroptosis, for stage 1, you will feel the lower pole of the kidney. Lower pole. Kidney, lower pole, upper pole, entire surface of the kidney. If there is nephroptosis, you will be able to find the lower pole of the kidney, like you will be able to palpate. If there is second stage, then you will be able to palpate the entire surface of the kidney. Third stage, you will be able to displace the kidney. These are the stages of nephroptosis. Okay? For some people, the kidneys would be palpable. So if you are able to palpate the kidneys, then you have to define certain characteristics like bean size, bean form of the kidney. Size, unfortunately, we cannot measure. So size, we don't tell anything. Smooth surface and immobile. Consistency, it's also not elastic. So again, bean form, size you cannot measure. Surface is smooth, immobile and non-elastic or inelastic. This is the conclusion for kidney. Before telling the characteristics, make sure you tell by during topographic deep bimanual palpation of the kidneys and so on. Kidneys are palpable or not, patient feels pain or not. Displacement, nephroptosis on the effective. If you want, you can tell also nephroptosis, absence of nephroptosis. Okay, the same thing you have to do it when the patient is in standing position. So we'll just imitate. Fix your hand. Inspire, expire. Inspire, expire. Inspire, expire. Do you feel pain? First you have to ask about pain and then teach the patient abdominal breathing. Inspire, do fold, expire, inspire, expire, inspire, expire. Unpalpable. Next. Inspire, expire, inspire, expire, inspire, do fold, expire, inspire, expire, inspire, expire. Did you feel pain for real?
No.
Patient doesn't feel pain. That means my technique was correct. Because sometimes people what they do is during inspiration they put their hand inside. That time the patient will feel pain because during inspiration there is tension of the abdominal muscles. Make sure that you are putting your hand in only.
So putting the hand only in expiration phase.
Inspire, do skin fold. Inspire, do skin fold. Expire, push in. Inspire, skin fold, push in. Inspire, expire. Inspire, expire.
So getting deeper. Inspire, expire, inspire, expire. So how many times do we need to?
3 times. 3 times.
Wait around.
So after this, what else we have? Before going for blood, I will do painful points.
Painful points.
I think you also have to tell tenderness. You also have to tell about tenderness, absence of any tenderness. Painful point for urinary system.
Painful points.
There are 3 painful points on the anterior side and 2 painful points on the posterior side. First painful point, find the free end of the 10th rib. First you find the 12th rib. Here's the 12th rib. Tickling.
Tickling.
Okay. Sorry. 12 trip, 11 trip, 10 trip. Okay, here's the free end of the 10th rib. Because the 10th rib is a false rib. Find the free end of the 10th rib. Do you feel pain?
No.
Before
Touching.
before pressing, you also have to ask about pain. Do you feel pain?
No.
Do you feel pain?
No.
First painful point. Second painful point is at the level of the umbilicus, draw an imaginary horizontal line, and the place of intersection of the lateral body of the rectus abdominis muscle, you have to place your fingers. Do you feel pain?
No.
Do you feel pain?
No.
This is the second painful point. Third painful point, imaginary line, that is biiliac line, anterior superior iliac spine, and the point of intersection of the pubic tubercle. Draw a vertical line through the pubic tubercle. Look at like here. Pubic tubercle here. Vertical line and biiliac line. The point of projection is the place of intersection between the two lines.
No.
Do you feel pain?
No.
Do you feel pain? These are the painful points on the anterior side. On the posterior side,
Patient is to 10.
of course.
Okay.
Find the 12th rib first. Find the 12th rib.
很痒，看我都觉得很痒。
On the on the posterior surface, find the 12th rib and find the point where the 12th rib is attached to the vertebral column. The place where it is attached, it makes an angle. This is the vertebral column. This is the attachment of the 12th rib. This is the angle. Okay? Understand? So find the angle again. Okay, here. Do you feel pain?
No.
Now press. Do you feel pain?
No.
Relax. Okay. Same thing. Go along the projection of the 12th rib and go move your hands till you find the longissimus muscle. Medial body of the longissimus muscle. Do you feel pain?
No.
Do you feel pain?
No.
Always know the painful points for your nervous system is
Painless.
painless. That's it for your nervous system. Now what? Bladder.
Do the painful points have like a specific name?
No specific names for painful points.
The
On the
first-
anterior surface,
Okay.
on the anterior surface and posterior surface.
Okay.
For the anterior surface, the first point is the intersection between the
No intersection. No, some say intersection, but it's the free end of the 10th rib. Usually it lies along the rectus abdominis muscle.
then the same line but going down to the umbilical.
Depends on the patient, because free end of the 10th rib might lie either medially or laterally.
Okay.
So that's the reason I tell you to find the free end of the 10th rib. Some people say that you have to, all the three lines are along the rectus abdominis muscle. It's not like that. Depends on the patient. This is the exact point, free end of the 10th rib. So next is determination of the upper margin of the urinary bladder above the pubic symphysis. Usually the urinary bladder is located 2 centimeters above the pubic symphysis. So we start percussing. From the umbilicus and we start percussing from the umbilicus and go till you reach dull sound. What kind of percussion is this? Topographic or comparative? Topographic.
So moderate.
Moderate. Let's remove a belt.
Hungry.
Here's the border, located 2 centimeters above the pubic symphysis. After percussing the border, you can palpate the border. Same thing, same technique as you palpated the intestine as well as the kidneys. So for this we use deep bimanual palpation. Here's the point. Do you feel pain?
No.
Teach the patient abdominal breathing. Inspire, expire, inspire, expire, inspire, expire. Go to the point again. Inspire, expire. Really, it shouldn't be.
I feel my bladder to move. Like
I feel the bladder.
You feel?
Did you void before? Did you void before? No.
Versus void.
Lot of fluid intake today.
They're just now for the swallowing on thyroid gland.
Yeah. Okay. So maybe that's the reason. Again. Inspire, expire. Inspire, expire. You just do it only once. Okay. The urinary bladder is palpable in his case. Again, we'll do it once more to make sure. Inspire, expire. It's palpable. Urinary bladder is palpable. But I don't know how to define the characteristics of urinary bladder.
In usual case, it's unpalpable.
Palpable.
Physiologically, it's palpable. It's possible to palpate.
Push, mulut to push.
Conclusion for urinary bladder. During topographic bimanual deep sliding palpation of urinary bladder, the urinary bladder was palpable, painless, absence of any tenderness, surface was smooth, soft, smooth surface, elastic, and mobile. Stop. Pause. You auscultate only the, I think you auscultate the ureter. I don't know what we are going to auscultate. I think it's the ureter. What's present over here?
What's on the ureter?
No, we auscultate for renal. Pause. Stethoscope again.
Stethoscope.
Everybody got it?
Yes.
So for auscultation of
Phonendoscope.
phonendoscope.
Only cardiovascular stethoscope.
Phonendoscope.
Shit.
Only
So make sure that the phonendoscope is working before you auscultate. First point for auscultation. First point of auscultation is from the umbilicus, 2-3 centimeters above. 2-3 centimeters above. That's the first point of auscultation. Usually they won't ask you to auscultate. Just make sure you know the point. Next point is 2 to 3 centimeters from either side of the umbilicus. Next is find the rectus abdominis muscle first. Rectus abdominis muscle, lateral margin. Rectus abdominal muscle till the umbilicus, divided into 2 parts. Point of intersection, auscultate again.
Yeah, why you?
This is auscultation points. I don't know how to make the conclusion.
Okay.